Welcome back, everybody. So as some of you may have seen, I posted a little while ago a photo on my Instagram. Feel free to follow me. My Instagram link I'll leave in the description below. But today is the last day of nursing school, at least my associate's degree. I do plan on going back for my bachelor's, but I'm going to take a little break, get in the hospital work, and then get back to it. Probably 3 to 6 months. I don't think longer than that, because I do want to get my bachelor's and just get it over with. But I'll be taking that mostly online, I think. But anyhow, that's not the purpose of this video. This video is to tell you a lot of stuff, hopefully in a short amount of time and not a super long video. But I just have here, I compiled kind of a list of my top 10 clinical must-haves that I found super helpful, that have really made an impact, or that I think are like necessities if you're going to do your clinicals, either for those who are just starting out in nursing school, or maybe those who are already in nursing school who might not have thought of it. I know about a year ago I did a video very similar to this with my top 10 clinical must-haves, but at the time I really wasn't in clinical setting. It was just things that I thought would be very, very, very important to have as a new clinical nursing student. So feel free to check that one out. I'm pretty sure it was like a year ago. It was like top 10 must-haves or something like that. But I tried to grab some this time that were different maybe than what I did in that video, except there are some things that I did find that were similar between the two lists that I had made, and that's because I found them very, very important. So I'll do that, and then I'll tell you how my first day of my last quarter went. So first on the list, and these are in no specific order, I just have them wherever I grab them in my thing here. And I'm going to start here first. The first thing I suggest, and obviously this is well used and loved, as you will see, is a binder. And it doesn't have to be a binder. I definitely suggest something more than a folder, because as you can see, there's a lot of stuff here. Then it wouldn't fit in a folder. But I just got this binder, and I'll put my name in it, but so I don't lose it in clinical. But it's that hard plastic, so it'll easily wash, to get germs and yucky stuff off. If anything, you lay it down in it or whatever. But what I did was, and I've used this the last 2 quarters in clinicals, and it's just worked really well. At one point I was using a clipboard, and sometimes I still do use my clipboard depending on the day. Usually if I'm going to be in an observation unit like ICU or the cath lab, where I'm really not doing a lot of clinical skills necessarily, it's more just observing, because I can't aid in procedures like cath lab or OR. I can still do the skills that we've checked off on catheters and NG tubes, etc., but I can't actually get in there with the doctors and nurses in actual procedures. So on observation days like that, where I might have papers that I have to fill out for class or something, I'll take a clipboard, because I have a clipboard that just closes. I have it here actually. And it's smaller. It doesn't necessarily, get in the way like this, where if you drop it, papers will come out or whatever. But I'll just carry this because I can shove whatever papers I need to fill out for clinical in here. I always keep some sticky notes and plain paper. But then it's just easier, because if the OR you can't take anything in, I'll just take the one piece of paper I need and a pen or something like that, rather than carrying a bunch of stuff in, because they don't want germs and all that good stuff in their OR. So I carry this around when I'm in the ED or on the med-surg floor or anywhere else. But I basically put in those plastic sheet protectors in here, so that one, it's easily wipeable, and usually I'll just go through and clean the outside off or whatever after clinical shifts. But I definitely recommend one of these. You can keep your papers or that your clinical instructor gives you, or any helpful papers that maybe you want to carry around with you. Like I have, we have to fill out for each patient, we have to fill out a form too. So I have all those in this little divider. I have a thing here on how to determine a fall risk or Braden scale, and how you measure those out. And then I have some papers here that our clinical instructors have given us over the years with or over the quarters with important assessment information to include. So I just have that all in this one place, and then I can carry it around. It's easily to wash off, and then everything's in one spot. Plus, HIPAA rules, it's covered. So if I just put in, patient's paper or information here, I can cover it up and nobody can see it. Nobody can get any of that particular information that is HIPAA. So that's the first thing. The next thing I have is, and you don't have to use a binder like that. You can use a folder. I think I've said that, but it's just whatever works for you. Sometimes it's just depending on what unit I'm going to be in, and most times I know ahead of time what unit I'm in, so I can prepare accordingly with what I want to bring in. The next thing I have is these vitamin C, oh, you can't see, vitamin C emergency packets. I like these raspberry ones. They just taste better to me. I actually had one this morning because I woke up and my throat was kind of scratchy, and I was like, I am not starting off the new quarter under the weather. So there's these little packets, and you just put them in water. I usually put them in like 6 to 8 ounces of water, just because I don't want to dilute it too much. I want to get that punch, basically. But I'll do one of these daily, just to prevent getting sick, especially on clinical days when you're going to be around a lot of people who are sick or have different, diseases or whatever, just to keep your immune system tip-top shape and keep you healthy. Usually I don't get sick very often, so these, I'm going to say, work. You can get them at Walmart. You can get them individual. They have like small 3 or 4 packets. I buy this big box. I don't really know how many it has. 30. But I know they have raspberry, there's orange, and I think some places, depending on where you go, has a mixed, like raspberry and orange or something like that. But I like the raspberry flavor personally, and it doesn't really have that great of a taste. I mean, it's bubbly and fizzy and kind of weird. Kind of tastes like you're drinking Alka-Seltzer or something. But definitely one of my recommended objects, because you never know. I'll keep a couple of these. I carry around a bag, as I'm sure some of you saw in my last video when I went way in depth in it, but I just carry around this bag, and I keep all my stuff in there, so it's all in one spot. It's easily washable, and I usually will keep 2 or 3 packets in here, and then if, any of my fellow clinical partners need one, I've got extra so that they don't get sick either. My next item is my Yeti. I got this actually this year for my birthday and love it. I'll put ice in here in the morning, and it's still in there when I leave clinical. It's good for hot or cold drinks. I usually put my iced coffee in here. I'll go to Dunkin' Donuts and get an iced coffee and pour it in here, and then drink it out of here, because it keeps the ice cold and then it's not melted, and then, when you get that under the bottom of your iced coffee, it's just like flavored down coffee, and that's disgusting, and half of your coffee's gone, because we all know that you're too busy in clinical to actually sit down and drink. So then I can just run to the break room as I'm doing something, grab a drink, and go, and it's still all ice, barely melted, and keeps it cold. So I strongly recommend something kind of thermal or something that you can keep a drink in. Just because it's important to stay hydrated. If you're going to teach your patients that they need to stay hydrated, you gotta do what you preach, So definitely recommend something like that you can use throughout the day to keep yourself hydrated. The next thing on my must-have that I found super helpful is a drug guide. I use this at least 3-4 times a shift, just because sometimes a patient will be taking something that I want to check, or if I check the compatibility of some drugs, I just keep this with me in my bag because I can go and grab it. Some sites, depending on where you are, and you'll find that out, don't allow you to use your cell phone or electronics or whatever. And a lot of places too now, a lot of hospitals have their own drug guides that they're including on their carts, computer carts. So you may not even need it, but I like to have my own because I can go and I don't have to wait for somebody to get off a computer, or if one's full, it's just right there. So this is Davis Drug Guide. It's the 14th edition, which is one of the newer ones. And I have a lot of meds that obviously I've used in the hospital that are frequent flyers, but definitely something I strongly recommend. This is also something I recommend for just nursing classes in general, homework, care plans that you have to do. It's nice to have one of these. So that's one. And the next thing I have is these RN notes, and I got these at, the Davis Drug Guide I got off Amazon. I think it was the cheapest I found. They have different sellers there. You can buy them new or used. It really doesn't matter. I bought that new. I don't remember how much I bought it for, but I like it. And then I bought this at our Barnes & Noble, RN Notes. This is helpful when I'm in the ED or something and I'm observing or watching. But you can go in here and see, like, it has it divided down at the bottom. It has different dividers with the information in it. So it says procedures, assess, lifespan, emergency trauma, meds, IV and fluids, labs, ECGs, diseases in patient ED, and tools index. But it basically gives you, like this one, let's just say I opened it up to electronic fetal monitoring, fetal heart rate patterns. So it looks like this. Oh, there you can see. And it just tells you a little bit about it so that you can reference. So baseline fetal heart rate, it says, is 130 to 140 beats per minute. Accelerations last greater than 15 seconds or are above baseline. That's a reassuring or normal pattern. And then some of them, it just has like little diagrams to just help you see. This one happens to be labor, but just to see, you know, where your patient is, or maybe what your doctor and nurse are talking about with each other. It has measurements for normal weight and stuff. Routine infant reflexes. Here's a defibrillation and pacing, so you know where the things go, which these are all also documented in the hospital, but it's just nice to carry this around so that you can kind of research yourself. This here is a ventilated patient in respiratory distress. It says disconnect ventilator tubing from ET tube and menu ventilate patient. Have the physician notified stat if not already done. Patient is easy to manually ventilate, or patient is difficult to manually ventilate. How to dislodge, obstruction, pneumothorax, equipment, just kind of walks you through like the processes, which again, oh look, wound culture, which again, a lot of the hospitals will have their policies and stuff for, but this is also really good when you're going to nursing clinical labs or something and you have to do certain procedures to just kind of brush up, and it's kind of like flashcards in your pocket. It's not really that big. It fits in my pant pocket super easily. Some days I carry this around, some days I don't. It depends where I am on the floor, if I think I might need it, but I have found it helpful when I've gotten it. It's water resistant, so I can write on it with marker and then come back, you know, at night and go through and erase it off with alcohol wipes or whatever. So I've just found that helpful. That's something that I personally enjoy and like to carry around with me, just because if I need it, I have it. The next thing I have is this pen light scissor combo set. I carry this. It fits right in my pocket of my scrubs. It has a little clip on the back here because my scrubs that I bought have a piece on the inside where you can stick pens and stuff so they're not falling around in your pocket. But I just take this and clip this in there. And then it has my bandage scissors, which I would recommend. I'm counting this all as kind of one set thing, but bandage scissors, which most schools require for clinicals. I have my pen light here, blind view, which has my pupil measurement on it. So it tells you how big the pupils are reactive. If they're reactive, maybe they're not. And then my other bandage scissors I have here, which if someone asks me to borrow my bandage scissors, I give them the cheap, inexpensive Walmart pair that was $2, and I leave the more expensive ones for myself. But I just carry that around, and then I can put in here, you know, if I have alcohol wipes or something that I don't want just floating around in my pocket, I can put those in here. One of the most important things that I recommend carrying with you, and I don't necessarily carry this with me because while I'm at the hospital they have wipes and stuff, but it's Clorox disinfectant wipes. I live by these things on a clinical day. Generally when I come back to my car before I even get in my car, I will take these Clorox wipes, I will thoroughly wash my shoes with them before I get in the car, because when you think about the things that you've stepped in or that have landed on your feet or maybe splattered on your feet, and then you're going to get in your car, and I mean, I know you're not going to get 100% of that off, but at least using these, I feel like for my own sanity, it keeps my car a little bit cleaner and a little less diseased. Because there's so many things that you can get in the hospital, so I just will wash my shoes off, and then I'll go through and wash all of my equipment, my stethoscope, my pen light, my scissors, my pens, just because I find that gross when people will go to clinical with using a pen, and then you see them the next day in class and they have the same exact pen, and you're like, okay, did you wash that, or, you know, are you just using the same pen that you're now sticking near your mouth, or holding and then touching your eyes, or it just, it grosses me out. So I keep these. I keep one in my clinical bag, and then I keep a small one in my clinical bag, and then I keep a big one in my trunk of my car, so that it's easily accessed. And sometimes when I'm sitting in post-conference and we're talking, and while we're engaged, I sit there and will like clean my utensils or whatever, or at least my stethoscope, because you think about that and all the things your stethoscope touches, and then you have it like around your neck or in your pocket, and it just grosses me out. So I definitely recommend some kind of Clorox wipes. I know they come in like small packages that you can get. I have one of those for my bag, but I'm actually out. I need to go to the store before my clinical's on Monday. So this is definitely like a number one in my bag. Must have. Definitely recommend. Because the thought of those germs is just slightly terrifying and disgusting and bleh. The next thing I highly recommend is dry shampoo. I generally would have to wake up super early for clinicals because I have an hour drive to basically any of our clinical sites or school. And I use this school days too because I'll shower at night and then wake up in the morning, and rather than taking another shower, I save an hour, well not an hour, but half an hour, and will just dry shampoo my hair to make sure it's not greasy or oily. I use the Dove Refreshing Care Invigorating Dry Shampoo just because I think it tends to keep my hair at less dandruff than other shampoos, dry shampoos. Because some of them dry your scalp out too much and then it's just gross too, but this definitely saves like half an hour off my time in the morning if I don't have to shower and I shower the night before, especially when you have to be at clinicals at 6, and if you have an hour drive, you know, I have to leave my house at 5, which means if I'm showering and everything I have to be up by 4 or earlier, and if I was up the night before studying, then I got no sleep. So I definitely recommend some kind of dry shampoo or something to that effect that will maybe let you get an hour of sleep that you wouldn't be getting otherwise. Because as you progress in the program, you get less and less sleep. The next thing I recommend is a notepad. I just carry this little one around. You can see where I've made notes in it and stuff. This is helpful when you want to jot something down, or you're taking a patient's vital signs and then you want to go log them in the computer. You just have to make sure that whenever you leave clinical, like what I have in here are just my personal notes. We had an orientation to one of our clinical sites, and so I wrote down how many beds it was, it's outpatient, what that stuff. But any like specific, I have passwords in here too, that's why I have it covered still, but any specific patient data you would want to rip out at the end of each shift. But this way you can just quickly jot stuff down and go about your way, and then, I'll write down, okay, the nurse asked me to do this, I did this at this time for this room, patient number, this is my findings. And then I'll rip it out, put it in the computer, throw it away. But I definitely recommend something like this, something that maybe you can take your notes on. If somebody mentions something, you're like, oh, I want to look that up, or write it down and go and look it up for studying purposes or whatever. So I recommend a notepad of some kind. It doesn't have to be fancy. Sticky notes, if that's your thing. It's all in one place there, and I don't have to worry about losing it or something falling out or whatever, unless I specifically pull it out. And then last but definitely not least is my lotion. This one just happens to be stress relief because nursing school and stress, they're synonyms for each other. I use this when I'm stressed. I use some kind of lotion I would recommend having, just because during the winter I find my hands get super dry because I'm washing them so frequently in the hospital that they'll get dry and cracked. And so if I can put some lotion on, at lunch, on a break, if I get a break, just to keep my hands moisturized. Also, a little trick of the trade, if none of you have experienced a patient with C. diff, congratulations. But I'm sure at some point or another you will experience it, and lotion is your key. Usually what I do is I find a very small, less strong scent lotion, and it doesn't have to be a big bottle, just something little, and I will take the lotion and I'll put it under my nose here. Vicks works too, but it's a little easier to smell Vicks, so if a patient can smell it, they might be offended. But just put a little bit of lotion right here, and then it helps me breathe clean air. Maybe you just had a patient who vomited that you're cleaning up off the side of the bed or something, or off them. I just excuse myself to go get some gloves. I put a little bit on, get my gloves on, and then go ahead and do it. So that's just a little hint tidbit for you to keep in your arsenal of supplies. So those are my top, I think it was probably maybe a couple more than 10, but at least 10 items that I recommend for nursing school, for clinicals at least. And then a quick update on classes. So today was the first day of classes, orientation for both classes. I'm taking 4 classes this quarter, nursing 3, my capstone class, roll and scope, and then junior seminar. And so we basically got an overview of all of our classes today, and we'll start actual classes later on. So I'll make a video then of everything going on, because we're still trying to figure it out. Our first day of class is Thursday, and I have lab Wednesday. So be looking for a video this week, the end of this week, on more information for that. But I hope you enjoyed the video, and I hope some of this stuff will be helpful for you in your clinical experience. Let me know if you have any questions, and I will talk to you guys later this week and give you an update on how classes are going and what I can expect this quarter, as well as how I get organized for classes. So look for that video by the end of the week. I'm just getting the finalized stuff on that for you. I hope you guys have a great week. See you in a little bit.